Welcome, everyone, to the University of New Mexico Law and Mental Health Series, weekly discussions of practice and science featuring experts in behavioral health and the law. This is a series run by the Division of Forensic Behavioral Sciences of the University of New Mexico's Department of Psychiatry and Behavioral Sciences in support with the New Mexico Behavioral Health Services Division. I'm Anthony Perillo, the Forensic Psychology Training Director here at the University of New Mexico. For our talk today, if you have any questions for our presenter, you can enter them in the Q&A box, not the chat box, the Q&A box. Enter those anytime you feel comfortable, but do know that we hold questions until the end, and oftentimes it's not possible for us to get through all of them. If you are pursuing continuing medical education credits, there will be a sign-in sheet posted in the chat box shortly. If you are pursuing APA continuing education credits, there will be a link to a survey that you'll complete in the chat box as well, but that link will be posted near the end of the webinar, so keep your eye on the chat box for that link. Save, bookmark, copy, open up that link before the webinar closes so that you have it to complete the survey, and then make sure you save a completed PDF version of the certificate afterwards. We don't have copies of those after the fact. If you missed last week's talk in the series, Dr. Abby Muley and Dr. Jared Ruchensky's discussion of dimensional perspectives of psychopathology, assessment, and forensic settings is now available on our YouTube channel. The recording for this week's talk should also be available on our YouTube channel sometime later this week, and a version of slides for those who have registered for the series will be available later this week as well. And as a heads up, next week we have Judge Steve Leifman, who will be discussing a judicial perspective on decriminalizing mental illness. But circling back to this week, I am honored to introduce you to today's speaker, who'll be discussing her work on protective factors against reoffending among youth. This is Dr. Gina Vincent. Dr. Gina Vincent is a research professor, co-director of the Law and Psychiatry program, and faculty in the Implementation Science and Practice Advances Research Center in the Department of Psychiatry and Behavioral Sciences at UMass Chan Medical School. She has received funding from NIMH, NIDA, the MacArthur Foundation, and JJ, the list goes on, for studies related to behavioral health concerns and implementation for best practice risk needs assessments and risk need responsivity strategies for youth and young adults involved in the. She has over 80 publications in the areas of risk assessment, adolescent substance use and mental health symptoms, callous on emotional traits, and implementation science-related studies. She is also president of the National Youth Screening and Assessment Partners, a technical assistance and training center that assists juvenile justice agencies with the implementation of various screening and assessment instruments and protocols. She's author of the Risk Assessment in Juvenile Probation, a guidebook for implementation manual, and has assisted over 50 county and state juvenile justice agencies in their implementation of risk assessment instruments and risk need responsivity-based case planning. So, Dr. Vincent, Gina, on behalf of the University of New Mexico, we are very excited for you sharing your expertise with us today, and I will go ahead and toss it over to you.
Thank you so much, Dr. Perillo, for inviting me here. It's wonderful to have the opportunity to talk with colleagues about this project that we're very excited to be disseminating the results for at this stage. So I'm going to be talking about the Youth Protective Factor Study, which is an unprecedented multi-state, multi-year examination of which risk and protective factors are most significant when it comes to reoffending, especially for serious offenses and especially for long-term reoffending among youth aged 10 to 23 who are involved in the youth justice system. This study has a web page, which I'm showing you, that contains all the results as they come out. We have a couple webinars and briefs posted on there, so you're more than welcome to take a look at that web page for upcoming findings. And I do want to thank my colleagues, Jennifer Scheme and Josh Weber. This was really a collaborative effort. We all investigated this together, and I'm going to be, Jennifer Scheme was the mastermind behind several of the details I'll be presenting today, actually. We also had a very robust research team who did everything from quality assurance with 35 different probation offices across the US to data management and analyses. And so I want to acknowledge their hard work in that as well. I don't know if you need to say anything about receiving continuing education credits, but I know that that's available here, so that's terrific. I do not have any financial arrangements to disclose, neither do the reviewers of this content. And the views expressed here are all mine and not necessarily representative of the views, policies, and positions of the University of New Mexico. Okay. And here's the learning objectives for today. One, I'm hoping that everyone at the end of this session would be able to list the protective factors with the strongest connection to reduced violent reoffending among youth. Second, you'll have a sense of how to measure those protective factors. And lastly, we're going to talk a bit about how to apply some of these strategies for bolstering key protective factors among youth. Okay, so to launch into the topic today, I imagine many of you have heard of positive youth development. This has been around for decades, especially in school settings, child welfare settings, and the like. And it is an intentional pro-social approach that suggests that we want to engage youth within their communities. We want to recognize and enhance their strengths. And we want to promote positive outcomes by providing them with opportunities and fostering positive relationships and also helping to flourish their leadership strengths. Right. Well, probably around 2005 was when we saw the first kind of writings about the idea of bringing positive youth development into the youth justice setting. And it's been coined as positive youth justice. And this is describing a positive youth justice approach. And the idea was to take an intentional approach, again, to engaging youth within their communities, enhancing their strengths, and promoting positive outcomes by providing them with opportunities and fostering positive relationships and creativity. And as you'll see from this table, all of those concepts that I just referred to are known as the practice domains. And the idea is that we will help bolster these practice domains for you, or that if we focus on these practice domains for youth, we will help bolster a couple of core assets within the youth. One is learning and doing. So in other words, developing skills and competencies that are going to help them be successful as young people. And second is attaching and belonging. So how to help them become positive, proactive members within the community. So I'm going to venture out and say that most people embrace the philosophies of positive youth development. We know from research evidence that the more protective factors youth have, the less likely they are to reoffend, and the more likely they are to be successful. And there's, a lot of talk around strengths more and more in the field of youth justice these days. However, there's some outstanding questions about how do we actually operationalize this, either within a forensic mental health context or in a youth justice context. So, for example, when we're dealing with systems that have really limited resources, is there any guidance as to which strengths or protective factors actually matter the most? If there's only so many resources that we have, are there certain ones that we should be targeting in order to reduce recidivism? How do we know which services and activities we have available to us are actually going to give us the biggest gains in helping youth to develop and promote these assets? And another related issue is, how does this fit with risk need responsivity? So I think I'm going to assume most people on here know risk need responsivity, and that's the dominant framework in youth justice and the adult legal system as well. Then many feel is too deficit based. And in fact, positive youth development, positive youth justice came sort of as a different approach to managing and working with youth because they felt that R&R was too deficit based. The issue here is that youth justice agencies are a little confused as to where they're supposed to be putting their efforts and their focus. Another issue here is that it's really been presented as positive youth justice is competing with R&R. It should be done instead of R&R, as opposed to talking a lot about how these two can be integrated. And so guidance is needed for youth justice agencies around how to do this. I want to talk just a little bit about what protective factors are and why they're relevant. I think most of us probably know that, but there's considerable research on the fact that people can face adversity, like traumatic events, but for whatever reason can overcome those things and still lead very successful lives. And that's where we refer to protective factors. Within the risk need responsivity model, as Brown and certainly Bonta and Andrews have themselves pointed out, they talk about strengths as a responsivity factor or a specific responsivity factor. There's a desire to move risk factors into strengths. That's one way in which R&R talks about strengths. Another way in which they talk about them is that individuals who are not motivated or who are weakly motivated to engage in any services or programming are going to need that motivation to be built up in order to help them to be successful, right? Which again makes these responsivity factors. And lastly, we know people who have a lot of strengths just tend to fare better. They tend to gain more from services. How do we typically measure them in the field right now, especially of the forensic mental health field, but also in the youth justice field, is we've got several risk assessment instruments that have included protective factor scales on one form or another. One of these is the START. It may be hard to see. Another way that this is measured is by the SAPROV, which it has both an adult and a youth version, which is just entirely an assessment of protective factors. I want to make clear that the word strengths and protective factors, these terms often get used interchangeably. They're really not exactly the same thing, but the definitions are really highly relevant to academics, but not so much relevant when we're talking about actual practice in the field. So our working definition for protective factors or strengths or whatever we want to call them today is that we're looking at it as a buffer. So in other words, when risk factors are present, individuals can have a protective factor that may interact with those to decrease reoffending. It's like a buffering effect. And the absence of a protective factor does not mean someone is less likely to recidivate. So in other words, having a supportive grandparent might be something that buffers against poor parental management or other types of risk factors that youth may be facing. A supportive grandparent may be a buffer, but not having a supportive grandparent doesn't mean the youth is at higher risk. And we wanted to be very clear that our definition is not simply the opposite of a risk factor. It has to have a buffering effect. There was one study that looked at this association between protective factors or strengths and recidivism and tried to put this within the R&R context. And what they found is that strengths mediated, not moderated, the need to service match that we see in R&R and the R&R model in the prediction of recidivism after accounting for youth risk level. In other words, the more strengths youth had, the more likely they were to have had their risk factors matched to services. And it was that match of risk factors to services that actually decreased their recidivism. It wasn't simply having strengths that decreased their recidivism. So they concluded that strengths are a responsivity factor, again, operating in tandem within that R&R model. All right. Back to the youth protective factor study. So we had a number of questions with this study, and we have our third brief coming out with the results soon, next week actually. But the three questions that I'm going to go through today were which factors protect youth from recidivism, if any? And we define recidivism as longer term, so post-supervision recidivism out by an average of 1.5 years, because we're most concerned with what youth are doing once they get out of the youth justice system. Second, do protective factors add incremental validity to use risk for reoffending and protecting youth from recidivism? So do they have added value over just knowing a youth's risk level? And lastly, are there any developmental differences in the association between protective factors and recidivism? It stands to reason that there would be. So when youth are younger, their parents are going to be more influential. When they're older, their peers are going to be more influential. We expect there to be some developmental differences in the type of pro-social support that matters. We also expect job skills to matter more as youth get older and much less when youth are younger. So there's a lot of reason to believe that there's developmental differences here, and that hasn't really been examined. And so that was another research question. All right, so we're going to go into our method. We conducted this study with 3 different states. And we worked with those states to select 5 jurisdictions per state. There were a total of 14 counties or jurisdictions involved in the study, and some of them were more rural than others because we wanted to have a mix. The states were all selected based on their use already in practice of a validated risk needs assessment instrument, which had to be conducted predisposition in order for this to work. They had to have a robust data system, or at least the ability to work towards that. And they had to have an interest in adopting positive youth development and assessing protective factors. So our states, Pennsylvania, Wisconsin, and Virginia, we had to agree to de-identify the states and all of our findings. So I'm going to just be talking about state 1, state 2, and state 3, and those results are not presented in the order that I'm showing you here, again, to retain confidentiality. So we had 3 states, 15 counties. What they did was they administered a protective factor survey put together by us to youth alongside the risk needs assessment. So the deal was that whatever that jurisdiction's policy was around when that risk needs assessment was administered, they were supposed to also administer this protective factor survey. 2 of the states administer the risk needs assessment at the point of referral, so they do it really early. Another state does it post-adjudication predisposition. That affects some of the samples that we get and some of the findings, so that's a relevant point. The protective factor survey has has 9 self-report measures that fall within 4 domains, which I'm going to go over in a moment. The idea was that youth could fill this out on pencil and paper or electronically. We had all these fancy ways that youth could fill this out electronically, like to send them a text, send them an email, whatever. What we found for any of you doing studies like this in the juvenile justice system, what we found is that good old-fashioned pencil and paper was the way to get this done. Very few youth completed it electronically. So if the probation officer didn't give them the survey, pencil and paper, and they didn't have time to do it after that intake where they did their risk assessment, it did not get done right away. So we were kind of working with probation officers to ask them to follow these kids, please get the survey, please get the survey. And so that will result in many missing. We define recidivism as new petitions up to 1.5 years post youth justice involvement. So this is a long-term follow-up. Okay. Protective factors that we were most interested in, and this was a great mind of Jennifer's scheme with a little help from me, were fall into 4 domains. So first was pro-social identity. The extent to which someone views their future possible self as pro-social promotes desistance from crime. And identity development is a critical part of adolescence. This is when their identities are forming. We also expected there to be some developmental differences here in the influence of pro-social identity on recidivism. And we measured this using 2 different scales, the moral ideal self scale and the moral internalization scale. Second domain was pro-social engagements, and we had several measures for pro-social engagement. We know, and this is one of the PYD philosophies, that increasing engagement in educational, employment, and community pursuits can be protective. And again, it's a primary goal of PYD. So we measured school connectedness, social responsibility, and inventory of involvement, and a measure of adolescent purpose. So did they have purposeful life goals and or career pursuits? Okay. Our third domain was social skills and supports, and we really focused there just on whether they had peer support, positive peer support, and positive caregiver support. And lastly, self-control and self-efficacy, which we measured using the brief self-control scale and the general self-efficacy scale. Both of these are known to protect youth against delinquent behavior. Right? So 9 measures falling into 4 domains, and these were administered to youth alongside their risk assessment. And there was self-report. So here was our final samples. Our whole sample for this study was over 3,000 youth. who were collected over a period of 13 months, which would be the point of their referral. They had to be youth that weren't currently involved in the system in order to get into this study. They also had to be eligible for a risk assessment based on the jurisdiction's policies. There were some big differences between our states. That's why I've broken down the samples by state. So state 1 and 2 both took youth at the point of referral. So at intake, state 3, their assessments were all post-adjudication. So we would expect that sample to be a little more serious, right? Some things I want to draw your attention to. First of all, state 1 has the largest sample of youth. That means it's the most well-powered analyses are coming from that state. State 2 had the youngest youth. That was why we selected this state, is we really wanted a range of younger youth. So this was the youngest and the smallest sample. And state 3 was the most serious sample in that they had the highest percentage of high-risk youth and consequently had the highest rate of violent recidivism. Because of the differences across these states, even though we intended initially to be analyzing data with all the youth together, because of the differences between these states at this point, we have only conducted analyses for each state separately, and we're looking at patterns and trends that have occurred consistently across those states. Okay. All right, a bit about the protective factor surveys completion. So again, we started out with over 3,000 youth. That means all those youth were eligible to participate in the study. Almost all of them received a risk assessment, and we have recidivism data on almost all of them as well. The completion rate for the protective factor survey was about 58%, so a little more than half, which is a sample of almost 2,000 kids. The reason for this completion rate was that for the majority of cases, the probation officer just missed administering the protective factor survey. This often happened in cases in those states where they were completing this at the time of referral, and the youth was just, case was just counseled and closed. So maybe the probation officer had the opportunity to get the risk assessment done, or not. Like some of them didn't even have a risk assessment, but they did not have the opportunity to get the protective factor survey done. The youth was gone. There was no way to get a hold of them. So that was a big problem. That's how most of them got missed. Only 8% of the entire sample refused. Only 8% of over 3,000 kids refused to do the protective factor survey. So the refusal rates were very low, and the majority of these were the kids who were not accepting a plea and were planning to go to trial. So they didn't do their risk assessment either. At least not at that time, not until post-disposition. A very, very small percentage of these youth just couldn't complete the survey. And we had validity scales in there to determine whether a survey was valid or not. Very few needed to be discarded because of validity problems. So the good news is most youth can complete these measures. We did make some modifications for them to be developmentally appropriate language and so on. Most youth were able to complete them, which is terrific. The only differences between our final sample that I'm going to be showing you the results from that have the protective factor survey and the original sample is that the protective factor survey sample had fewer non-Latino white youth and fewer low-risk youth included in it, which makes sense because all those youth who were just counseled and closed or dismissed or just got taken care of right from the outset, those are the youth who didn't get the protective factor survey. So, and this was all due to just one state. There were no systematic differences in who did and did not get the survey in the other two states. So we feel like the sample is actually quite representative. Even though these differences were significant, they were minimal. We still have a high proportion of low-risk youth in our sample and a high proportion of white youth in our sample. Here is the final sample description. As you can see, most of them were boys, as we would all expect. The most common race, ethnicity was Black. The average age was 15, which is a little bit younger than we typically see in these settings. The risk level, they were pretty heavily low risk or moderate risk youth. And the majority of them, I'm going to say majority, the most common disposition these youth received was community supervision. That includes probation or consent decrees. A sizable chunk of these youth, again, because there was a lot of low-risk youth in this sample, were just diverted or handled informally. which is also great to see because they're following the risk principle here of R&R. However, it would be nice if these kids were not getting referred to the system to begin with. 40% of our whole sample was low risk, 40 to 60% across the states, and they didn't get services and they didn't get a lot of attention. So why bother referring them to the youth justice system to begin with? It's just causing more interference. But that's another soapbox for another day. Okay, so hopefully I've described the methods and the sample, and now I'm going to get into the meat of the findings, which is the exciting part. Everything I'm presenting here, most of what I'm presenting here, you can also find in our brief. This is our second brief, which is also on our website. So number one, we were just curious, what do youth protective factors look like? What do the youth who are coming into the youth justice system look like in terms of their strengths or protective factors? We don't have great data on that, except for states that use the YASI. But I haven't seen a lot of prevalence reports or the like talking about what kinds of protective factors youth are coming in with. And the way the YASI defines protective factors isn't necessarily consistent with some of what we've done here. So we found this very interesting. So a quick methodological point is that these protective factor surveys did not come with cutoff scores. There's no cutoff to say, yay, they have this protective factor or they don't. There's no dichotomizing on these scales. They're all continuous scales. So we created cutoffs on each of these based on the score at which 15% or less of youth recidivated post-supervision. So we wanted a cutoff score that was meaningful. And we figured that that cutoff that identified like the youth who were less likely to recidivate worked. And we did that in order to be able to provide information about how many kids actually have protective factors when they're coming into the system. So it was very surprising to us that a large percentage of youth coming into the system have pro-social identity or are high in pro-social identity. Both the pro-social identity measures had 60% to 80% of kids showing that meeting the cutoff. The other surprise was that there were a whole lot of youth coming into the system that are reporting having self-efficacy. So that's great. That's good news. Where they're low seems to be when it comes to having a sense of purpose. So do they have some goals or life pursuits, and self-control? That's where they were the lowest. Pro-social support was kind of in the middle. We'd like to see it be higher, but self-control and pro-social engagements were the protective factors youth were least likely to have. So the first question, getting back to our research questions, which factors, if any, protect youth from recidivism? And we're talking again about post-supervision recidivism. And these are bivariate analyses where we were just and there were survival analyses, obviously, where we were just looking at what predicts lower recidivism. We controlled in every analysis, we controlled for age, gender, and race. And there were some differences across the states, but there was more consistency than there were differences. So self-control, by and large, was the one protective factor that protected against post-supervision recidivism across every state, regardless of the size of that state sample or the age of the youth in that state. So that one was consistent. The other one that was largely consistent was self-efficacy. And in the first state, which is we're going to refer to as the best powered analyses. So this is the one where we're able to pick up on even small effects. In that first state, every domain that we studied actually was predictive of reduced recidivism. Okay. Question 2. Do protective factors add incremental validity to use risk for reoffending? So is it really enough to know what protective factors are associated with lower reoffending? Or is the question, is a question, are they really protective? So are they really protecting youth despite youth having a lot of risk factors? Are these protective factors adding unique value to our prediction of reductions in recidivism? This is really the priority question to be able to determine how much emphasis do we need on bolstering youth protective factors over trying to address risks. So I'm going to show you, these are the results for any recidivism post-supervision. So this is still, we're not talking about status offenses here. We took out any status offenses or really petty offenses because we're only concerned with real recidivism and real offenses. And I'll show you each state. So in the best powered analysis, this is an incremental validity, again, above and beyond risk level and after controlling for gender, age, and race. And these are survival analyses, and what's on the graph here is the hazard ratio. So what I'm showing you is that in the most well-powered state, almost every domain protected protected youth despite their risk level from recidivating. That was only in the best powered analysis. So if we look at state 2, which had the smallest sample, it was not significant, and it almost looks like protective factors had the reverse effect, but I wouldn't interpret that this way because this really means that there was just a lot of variability in the hazard ratios here for state 2 because the sample was so small. And in state 3, at least the protective factors were all in the right direction after accounting for use risk level, but none of them achieved a level of significance with respect to any recidivism. When we look at violent recidivism, however, we see a very different pattern. So with respect to violent recidivism, in the best powered analysis, pro-social engagement, social support, and self-control and self-efficacy all added unique value to risk level in determining who is less likely to recidivate. All 3 domains did. And in other analyses that weren't as well powered, self-control and self-efficacy still did add value above risk level. To be honest, this was a little surprising to me that these protective factors really came out as incredibly strong with respect to violent recidivism post-supervision. And the take-home message here is that self-control and self-efficacy really matter. And pro-social engagement and social supports, we would also say matter. However, those effects may be a little bit smaller. Okay. Next, the question was, are there developmental differences in the association between protective factors and recidivism? This is a little tricky. So there were. The short answer is yes. Some of this is very intuitive. So the younger youth were most strongly protected by school connectedness. So they had a bond to school. That was a protective factor for the youngest youth. In the best powered analysis, again, we also found that pro-social identity and having a sense of purpose were protective against any type of recidivism and violent recidivism. Okay. There was the only finding here that didn't make sense was for state 2, which found that self-control and self-efficacy protected mostly for older youth, whereas state 3 found it was the opposite. And I'm sure a big part of that has to do with the range of ages in those samples. But the most consistent finding is that school connectedness matters more for young kids. That's probably not shocking. And self-control and self-efficacy matters a lot for younger kids as well, as does pro-social identity and pro-social engagements. This is just a graph. This is the predicted survival probability showing the association between age and risk level and protective factors. So we looked at the interaction, whether age had a moderating effect on the incremental validity of protective factors above risk. Okay. And what this is showing is that after accounting for use cumulative risk of reoffending, um, sorry, the predictive effect of school connectedness really depended on the youth's age. So at the high level of school connectedness, at higher levels of school connectedness, which is on the x-axis there, the likelihood of surviving in the community without having a new violent petition sharply increases for young kids. So you can see how much this matters for the young kids, whereas for the older kids, it really didn't have any effect at all. That wasn't so true with the other areas where we saw age effects. In the other areas where we did see age effects around protective factors, they still mattered for older youth. They just didn't matter as much for the older youth. This is the one that was really striking, where the young youth ideally are going to be ideally you want to have them connected to school in order to protect them against recidivism, despite their risk level. So conclusions, and then I'm going to go through what the conclusions are here, and then I'll give a few implications and open it up for discussion. So first of all, good news, protective factors can be validly assessed in youth justice settings with a self-report inventory. I say that because these clearly have a connection to recidivism. All right. We didn't have many youth refuse. We didn't have many youth who could not complete the survey, and we only eliminated very few based on our validity checks. So they can do this, and the protective factors matter. Another interesting finding here is that some of the protective factors, if you compare our youth justice population to a general population, which is not what this graph is showing you, but if you compare our numbers from the youth justice population to the general population with where some of these surveys have been conducted, the self-efficacy level and the pro-social identity level of our kids in the youth justice system weren't that different from the general population. In other cases, that was not true. So this graph is showing you the brief self-control findings. Our population was much lower, had much lower scores on that than the general population, right? So there are areas where the youth justice population didn't look that different, and there are other areas where they did. The other area where they did, again, was having pro-social support. So the youth justice population was less likely to have pro-social support and less likely to have self-control. The most consistent protectors against violent post-supervision recidivism are self-control and self-efficacy. These really matter. They matter above and beyond youth risk levels. So even high-risk youth, if they've got self-control and self-efficacy, they seem to have decreased likelihood of recidivating violently. Others that really seem to matter are pro-social engagement and social support. These mattered mostly in the most high-powered analyses. When I'm advising youth justice agencies now, I do suggest that self-control, self-efficacy, pro-social engagement, and social support is where they may want to put their efforts. Okay. There were developmental differences, again, primarily with respect to school connectedness, matters more for younger kids, but also so did pro-social identity and sense of purpose. And I will say a limitation in the study, because we have been asked about this by others, is that we really did not assess job skills or youth competencies in education or in jobs. And that's an area where I think we'd want to see more research, because the most common type of service youth are getting in these settings in order to bolster protective factors is job training. But we didn't really look at job training in this study as a protective factor, so we can't tell how much job skills are really protecting youth against recidivism. So that was one oversight that if I had to do it over again, I would do that. I would do the study again, and I would add that kind of measure. I seriously doubt we will be doing a study like this over again, because it was quite expensive. But in a perfect world, I would highly recommend seeing how much job competencies and job skills protect youth against recidivism. One implication or takeaway here, uh, practitioners and youth justice systems may consider routinely assessing the protective factors that we found to be most influential. We also were not able to do repeated measures of these protective factors to see if anything youth were getting while they were in the youth justice system was bolstering their protective factors. If we were to do the study again, it would be wonderful to do that. It just wasn't practical here. But we can say that these are the scales that we would recommend people use if you're measuring if you want to measure protective factors. So I've given you the citations here. I know that these PowerPoints will be handed out. Um, not all of these are in the public domain. Some of these we had to ask the authors for permission to use their scales. So not all of them are in the public domain. I do want to make that point. Everything in red here are the scales that matter the most for the younger kids. Okay. If you could only pick a few, I would recommend doing those first three. All right. And one suggestion may be that when working with younger youth, we want to prioritize protective factors differently, or we want to prioritize services slightly differently. With the younger youth, we really want to focus more on school and getting them bonded to a school. It doesn't mean performing better at school necessarily, but just having a connection to it and seeing it as important. Having pro-social caregiver or a caregiver who's particularly engaged and supportive, and having that pro-social identity, because that really starts formulating at a very young age. Okay. Couple other points I just would like to talk through. So we can say that based on these study findings, measuring protective factors, particularly the ones I just showed you, are important. They give us some information about who's most versus least likely to recidivate seriously. But it would really be nice to know what can we do to help bolster these youth protective factors. So say we have youth coming into the system or youth in the forensic mental health system who don't have self-control, they don't have self-efficacy, and they don't have pro-social support. What do we do? I can tell you, this is a teaser alert. I'm not going into these results today, but we have presented these in prior webinars, and that you can find the information on our website. We documented all the strengths-based services that the kids in this sample were receiving, over 3,000 kids. We documented all the strengths-based services they were getting, either because they self-referred or the youth justice system referred them. It's a very robust data set. And what we found with some very sophisticated statistical controls performed by Jennifer Scheme and Dr. Louis Gian, what we found is that on the whole, kids who are getting strengths-based services were more likely to recidivate, not less likely to recidivate. We have not teased those apart to see if specific strengths-based services are adding value to reducing recidivism versus others. We've just looked at strengths-based services on a whole, and the higher the dosage, or whether they got one versus none, both showed in robust statistical models that they led to increased recidivism, not decreased. So it is not clear how we bolster these protective factors. Well, what is clear is that the way youth justice systems are implementing positive youth development right now is not having the effect that we would hope. So there's no direction being given to them really about what strengths-based services are going to matter most. Where should they put their resources? Which ones are going to give them the biggest reductions in recidivism? Which ones are going to help them help the youth succeed the most? We don't know, but we can say the most common strengths-based services youth were getting were either leisure activities of some sort, structured or not, or job training and work placement. Okay. So conceivably, you put youth into a work placement or a pro-social activity without also addressing some of their risk factors, like how they interact with other people, their anger control, the way that they think and their attitude, without addressing some of those, and we just put them in some of these strengths-based services, it may be having adverse effects as opposed to positive effects. So we have a lot more research to do to really tease this apart, but on the whole, the way that this is being implemented in youth justice settings is not looking good. I will say that how do we bolster these protective factors that matter the most? Self-control and self-efficacy. Probably things like DBT, which is focused on teaching youth how to do both of those things, or a CBT type of approach, or any kind of family approach that has behavioral components. So these are some of the research on self-control has found that those are the services that may bolster it. What are the implications for positive youth development and implementing positive youth development? The idea that young people can develop and flourish if they're connected to the right mix of social resources makes good sense. And even Jeffrey Butts himself, who has done some of the most writing on this in the justice space, talks about the fact that there may need to be some modifications of positive youth development and this approach to have it work better, operate better within the youth justice setting. So traditional models of PYD basically prescribe that every youth should be given the same opportunity to get these strengths-based services in those practice domains I showed you earlier to help bolster their attachment and belonging and their ability to learn and do. Every youth should get them. Unlike the R&R model, there's no kind of risk principle that says highest risk youth need more or low risk youth need less. It's kind of just everyone should get them. Okay. Right now, it's not clear whether some of those assets matter more than others with respect to what's going to increase youth success. So it's not clear who should get them, who should get more. It's not necessarily clear what they should be given. And there's also not a guideline in positive youth development around matching like we have in R&R. So there's no guidance around if the youth does not have this, we want to give them this. It's just kind of everyone should get everything. Our initial look at this is suggesting that that's not the case. It's not the case that everyone should just get everything. We should really try to look at which strengths-based services are mattering the most and are going to bolster the protective factors that we know matter the most. Right now, research might suggest that would be things like CBT and DBT are going to bolster self-control. We do need to look at what kinds of services are helping bolster job skills and work performance the best, and seeing whether that protects against recidivism or not. We have not done that. We did find that within our study, low-risk youth were the ones most likely to get the highest dosages of strengths-based services. So they're not giving them and distributing these services to everyone equally. They're mostly going to the low-risk youth who probably don't need them. They may not need them. These were the youth that didn't recidivate to begin with. So I'm going to leave it at that those are some open questions for next steps. And it's really important to figure out how to implement this approach well in a way that's going to help make youth more successful. And here's a few references and the QR code to the evaluation link. And I'm going to pause there and give 10 minutes for Q&A.
Thank you so much, Dr. Vincent, for that thorough overview of all the work that you've been doing in this area, both as far as the quality of the work and just the matter of approach in terms of strength-based approaches and what we've needed in forensic rehabilitation for the lifespan, let alone particularly focused for youth. So thank you so much for sharing all of this. We do have a number of questions here. We won't be able to get through all of them, although you did anticipate several people asking about this potential disconnect of who is actually getting services at what intensity. Was that perhaps an explanation here for these unexpected findings? Yes, several people chimed in about that as something that rung for them. Up here on the slide, you can see the QR code that you can scan in for a link to complete the survey. And in the chat box, there is a link there. If you are pursuing APA continuing education credits, feel free to click that link, bookmark it, use it at any point. I'll go through a couple of questions here with Dr. Vincent until we get to the top of the hour, and then we will wrap it up from there. So a couple of people have asked questions related to this self-control, self-efficacy factor, and given the emphasis there, I figured I would throw a couple of questions there. Somebody did want to clarify with the caveat they may have missed it, but what are the distinctions in this study between self-control and self-efficacy?
Yeah, yes, thank you for that question. So self-control is I think the easiest way to describe it, self-control is very behavioral. Like, can they actually control their behavior? Can they control their reactions? Um, or, and is obviously related to impulsivity. Whereas self-efficacy is more of an attitude. It's more of an attitude that I can overcome or accomplish the things that I want to accomplish. So that's how they differ. So self-efficacy is, talk about it like just this view that I'm going to be okay and I'm going to learn how to do this and I'm going to get through this. So that's really the difference. One is very behavioral and one is much more internal and attitudinal.
Wonderful. Thank you for that clarification. And a couple of people in their questions, it seems to have reflected this focus on self-control being more of the behavioral aspect. We had a couple of people that were asking essentially about any potential measure or disconnect between self-control, how youth perceive it versus any kind of behavioral or objective measure of self-control. How is it measured here, and what is the overlap from your understanding of how you
Uh,
perceive that versus how it is actually measured?
yeah, that's a great question. So it is fair to say there may be a bit of a limitation here because it's the brief self-control survey that we use, and I cannot remember for the life of me how many items that has now. I want to say 13. And it's from the youth's perspective, right? So the youth is filling this out from their perspective. But as you can see, their perspective on their ability to control their own behavior was very strongly related to whether they recidivated or not. So whether that means that they have good insight into their ability to control themselves or self-regulate. Um, I'm not sure, but essentially I think that I hope I'm answering your question that yes, it's their perception of their ability to self-regulate, but that mattered. That clearly mattered because it was the most predictive measure that we had.
Great. And related to this, somebody asked, where does self-reflection come in? Is this defined in the areas of self-control or self-efficacy? Any thoughts on that?
I'm not sure. That's a great question. I'm not sure how to answer that. I Yeah, I'm not sure how to answer that. Somebody else who's on here who does a lot of clinical work may be really good at answering that, but I'm not sure where the self-reflection comes in. I mean, they do have to have some insight in order to fill out these measures accurately. But what we're seeing is that the measures are valid. They are strongly attached to whether they've recidivated violently or not. So they're doing something right, which tells me that they've got some insight into their self-efficacy or their self-control. But I don't know where self-reflection fits in, to be honest.
Fair enough. Thank you
Yeah,
for that.
sorry.
Yeah. Did you develop any measures specific to gender? And if so, were there any gender differences?
Hmm. So yeah, great question. We did not develop measures specific to gender. We controlled for gender and race and age in all the analyses that I showed you just to remove any gender specific effects when we looked at and also we know girls had lower recidivism rates. So there's a lot of gender specific effects that we had to control for in the analyses we showed you. There were some small gender differences with respect to prevalence of protective factors. If I recall, the girls were more likely to have pro-social support and school connectedness than the boys. We did not, I cannot remember if there were gender differences with respect to predictive validity of these protective factors. But we have looked at that, and I would be more than happy if there's a way to respond to people's questions after the fact. I'd be more than happy to just get that information to you, to shoot out to folks.
Certainly. If we would like, I can let people know your email address at the end of this talk if they have any questions.
That would be great. Why don't we do that? Because I can answer that question. I just can't answer it off the top of my head. But we did look at both the differences in prevalence of protective factors between girls and boys and difference in predictive validity. And there were a few.
Wonderful. I'll throw that out as the final question when we get
Okay.
there. Yeah. Somebody asked in terms of measurement here, are the protective factors for violence recidivism similar for sexually violent offenses? Are they included in this violence recidivism data?
It's a great question. So I can't tell you, this is something that we could look at because we have all the offenses that the youth were referred for. But I can't tell you off the top of my head how many youth within these samples had been referred for a sex offense. And we did not look at them separately because I believe it was a very small number. So the data I'm showing you is aggregated across youth, regardless if they had been referred for a violent offense or a sex offense or some kind of less serious offense. So we didn't look at it specifically. I will say generally in these kinds of youth samples, we're not seeing high numbers of that. So I'm not sure we'd be able to analyze it separately, but I do have a lot of research coordinators who would love to look at the data more thoroughly, and I might suggest that to them for an analysis.
Wonderful. Thank you. Somebody asked a broader literature youth violence question and how that might relate to your findings here. They preface with a lot of the juvenile justice literature is focused highly on trauma histories and immature brain development as it relates to recidivism and rehabilitation. However, of course, the vast majority of traumatized youth and adolescents do not commit violent crime. Can you comment on how trauma and brain development can be related to your study and findings?
So I can't comment on how trauma would be related. I except to say that I mean we know it's a whole other issue whether trauma is related to violent recidivism and in what context and for whom. But we did try to get mental health screening of these youth. Not every state was administering mental health screening consistently. And so we couldn't look at mental health and how it related. So we can't speak to that. We don't have diagnoses. We did try to get mental health screening data, but we don't have it. So I can't speak to the trauma, but I can say brain development. We would have loved to look at developmental differences based on you's actual maturity level. It was just too much to try and do measures of each of these you's level of maturity. When we're talking about almost 3,400 youth, we're asking probation officers to do this. They're not going to do it. Not likely to do it well. I mean, this was a huge undertaking for them just to do the protective factor survey because they've got a lot on their plate. So the bottom line is we could only look at developmental differences based on biological age, which we know is not the ideal measure of doing it. So we would love to look at developmental differences on risk factors and protective factors based on you's level of maturity. I think I would ask my colleague Beth Kaufman if she has done that. But so we can't speak to the level of maturity. All we have is the biological age. That would be a great next study if we could
Certainly.
get the federal government to fund it.
Yes. And as we reach the top of the hour, I will throw that final question of if people have additional questions or want to reach out to you, what would be the best way for them to do that?
Email, and I think that could go out along with the presentation, but gina.vincent@umassmed.edu, but you can Google Gina Vincent at UMass and my email will come up.
Wonderful. And I have typed that into the webinar chat for our current attendees so they can see that if they want to copy and paste that as well for any future questions for you. Dr. Vincent, again, thank you so much for sharing all of your knowledge, the work that you do in this area, and approaching this and all the questions that our attendees had. Thank you so much for all of that.
Thank you, everyone. Thank you for having me.
And
care.
that wraps up this week's Law and Mental Health series. Again, next week, we will have Judge Steve Leifman, who will be discussing a judicial perspective on decriminalizing mental illness. We hope to see you then for another great discussion of issues in behavioral health and the law. Until next time.
Bye.
Bye.